Hello everyone, welcome to our medicine channel. My name's Mohammed. Today we have the general physical examination and especially of the pediatrics. There is some connection in the information regarding to the examination between the examination in the pediatrics, in the internal medicine, in adults, in the general surgery, for example, the Pallor, the cyanosis, Jaundice, looking in different age group. But in this lecture, we will take the general physical examination and especially of the pediatrics. But before doing anything, firstly, we will take the pediatric history, full pediatric history. The history and examination, it is very important in the reality because the diagnosis is not doesn't only depend on the investigations. The investigations alone there is no any benefit in the investigations and the diagnosis. But regarding to the history, examination, and the investigations, yes, you can reach the full diagnosis. When reach the exact diagnosis, not the differential diagnosis, you can treat the patient. So the general physical exam is not easy like in anyone. Should be carefully done, and especially in the pediatrics. Signs of dehydration very important. The signs of malnutrition very important. In the general physical examination, firstly, the general looking to the patient. The patient, for example, lying comfortable on his bed. Comfortable or not? So it's very important. Lying or not? Sitting. So the age group of the patient, the level of the consciousness and the position. What by meaning? This is the general looking. For example, infant, for example, patient 3 years of age, patient 2 years of age, sitting on his bed, not comfortable. The level of consciousness, when I take the history, during I am taking the history from the mother, the baby looks me like this. And have fun. What that mean? That mean toddler patient sitting on his bed, alert level of consciousness and comfortable. So this is the general looking. Or maybe patient has SOB and the cry. What you say? You say infant patient or toddler patient, alert or drowsy level of consciousness, or drowsy, lethargic, I say crying. So the baby is lethargic. The baby is irritable. So firstly, describe the age group. You say infant or toddler patient, then the level of consciousness. The baby is calm and looks toward the environment, looks toward this noise. For example, like this, when you take this, the baby looks. You do this, the baby also looks. This alert, that means the level of consciousness alert and responsive. What the other level of consciousness, especially in the pediatrics? The baby may be drowsy, sleepy, or maybe comatose. About the position, is the baby lying flat on his bed or prone position? So, supine position, maybe prone position, maybe sitting position. Okay. Is the baby comfortable or not? So, for example, you say toddler patient, alert level of consciousness, lying on alert level of consciousness, lying comfortable on his bed, but supine position. This is regarding to the general looking. Then, the first parts, the higher distribution. The higher distribution and looking. Normal patient, you say normal higher distribution and looking. But for example, in this patient, what you will say? There is focal higher loss. There is focal higher loss. In the upper part, you describe the site. If you find higher loss, you will say it is focal or diffuse. This patient has focal higher loss. Some patient has diffuse higher loss or multiple. So there is focal higher loss in the upper part of the temporal region. This is regarding to the higher loss. You will not say alopecia. Alopecia is disease. It is not sign. Alopecia is autoimmune disease. characterized by presence of hair loss. And there are different manifestations. So the alopecia, it is not sign, alopecia is disease. If you find hair loss, you just say there is hair loss, focal or diffuse, and you describe the site. It's regarding to the hair distribution and looking. If you didn't find anything, you just say normal hair distribution and looking. Then the very important three signs that you look for the pediatric patients: pallor, cyanosis, and jaundice. So it's very important: pallor, cyanosis, and jaundice. Regarding to the pallor, where you will find the pallor? You will find the pallor in three sites: the conjunctiva, and the mucous membrane of the mouth, and the palms of the hand. Three sites for pallor. What the causes of pallor? Number one, anemia, but not always anemia. It could be hypothyroidism, it could be shock, it could be infections, it could be different causes of the pallor. So, how can you examine or look for pallor? The conjunctiva, number one, either one eye or the both eyes together. One by one or both eyes together, look for the conjunctiva. If it is red, okay, there is no any pallor conjunctiva. But like this is not red. This is pallor conjunctiva. This is number one, the pallor conjunctiva. Number two, the sites for the pallor is the mucous membrane. Looking for the mucous membrane. This is the mucous membrane, pallor mucous membrane. This is the second site for pallor. And the third site for the pallor is the palm of the hand. So in examination, looking for the palm of the hand of the baby, of the patient, for what? For pallor. For pallor. But how you can find pallor in the palm of the hand? Looks for what? Looking for the palmar creases. If the palmar crease is pallor or light in color, not dark. For example, this is my hand. Dark palmar creases. Okay. Patient with anemia or pallor, you will find light palmar creases. Light palmar creases. And in severe anemia, when the HB less than 7 gram per deciliter, the palmar creases may be not recognized. This is regarding to the sites of pallor. So the very important sign, number one, is the pallor. Number two is the jaundice. What do I mean jaundice? Jaundice is the yellowish discoloration of the skin with mucous membrane, and it's very important, the sclera of the eye. Not only the skin. When the skin is yellowish, not always jaundice. It could be hypercarotenemia. So, how you will define jaundice? Jaundice is the yellowish discoloration of the skin and the sclera of the eye. Due to what? Due to elevation of the total serum bilirubin. It could be indirect and it could be direct. And there are different causes of jaundice. In adult, when the total serum bilirubin more than 2 milligram per deciliter, the jaundice occurs. But in neonates, when the total serum bilirubin more than 5 milligram per deciliter, then the jaundice appears. How you can examine jaundice? Not the skin, not the mucous membrane, the sclera of the eye. Examine the sclera of the eye. How you can examine the sclera? The upper and the lower sclera. Firstly, the upper sclera. Firstly, the lower sclera. Ask the patient to look for your finger. Okay. Now I will examine the lower sclera. Then examine the upper sclera. Either one by one or both eyes together. This is examination for the sclera, because the sclera, when you find the sclera yellowish, directly there's jaundice. This is regarding to the jaundice. Number three, the third most important sign, also the cyanosis. What by meaning cyanosis? Bluish discoloration in the skin, bluish discoloration in the skin and the mucous membrane. Why? Due to elevation of the deoxygenated hemoglobin more than 5 gram per deciliter. How you can examine jaundice, cyanosis? Just inspection to the mouth, especially the lips, the tongue, and the hands, hand and feet. During examination, when you examine other signs, if you find cyanosis, bluish discoloration in the lips, or tongue, or hand, or feet, so you can say the patient has cyanosis. The cyanosis are two types according to the size, and also the causes depending on the type. The central cyanosis, cyanosis of the lips and the tongue. Why? The causes due to congenital heart disease, congenital lung diseases, etc. This is regarding to the central cyanosis. And this is the peripheral cyanosis, or the acrocyanosis. What do I mean acrocyanosis? Cyanosis of the hand and the feet. The hand and the feet. Why? Due to peripheral vascular disease. This is regarding to the cyanosis. So firstly, the general look to the patient, the age, the level of the consciousness, and the position, comfortable or not. Number 2, the higher distribution and looking. Number 3, 4, and 5, signs of Pallor cyanosis and jaundice. Pallor cyanosis and jaundice. Number 6, you say if the patient has dysmorphic features or not. What do I mean dysmorphic features? In the face, certain diseases have dysmorphic features that directly diagnose it. So, some diseases have dysmorphic features. Through the face, you can diagnose the disease. For example, this patient has short palpebral vision, smooth philtrum, thin upper lip, and in the history, in the prenatal history, the mother was alcoholic during pregnancy. This is fetal alcohol syndrome. This one of the dysmorphic feature. Directly depending on the face, you give the diagnosis. This is called dysmorphic feature. The second dysmorphic feature, frontal higher line, coarsening of the facial features, opened mouth, protruding tongue, and large tongue, short neck. This what? Congenital hypothyroidism, cretinism. Also dysmorphic feature. And the third dysmorphic feature, slanting eye, snub nose. This is what? This is the Down syndrome. So, also what? Moon face with hirsutism. This is the acanthosis nigricans and the buffalo hump. This is what? Cushing syndrome. So, these are dysmorphic features. And there are different dysmorphic features, for example, for the Turner syndrome and for the Marfan syndrome. Turner syndrome, web neck. But there are also different manifestations, not only in the face. So certain diseases have manifestations in the face that directly you can diagnose it. This is called dysmorphic features. If you find normal baby, if your patient is normal, there is no any dysmorphic features, like me, what will you say? You say there is no any dysmorphic features. Then look for the signs of dehydration. Very important in the pediatrics. In this exam, especially in this sign, you can determine the level of the dehydration and thus the type of the IV fluid and the volume of the fluid that you give to the patient, regarding to the signs of dehydration. What are the signs of dehydration in the pediatrics? What are the signs of dehydration? You must examine. Examine what? Examine the fontanelle. You will palpate the fontanelle. You will find severe depression of the fontanelle. This is number 1. By inspection, there is sunken eyes. Number 2. Number 3. When the patient cries, there is no any tears. Number 4. Dryness of the mucous membrane of the mouth. Number 5. Capillary riffle. What do I mean in capillary riffle? For example, me. When I compress the finger pulp in the distal part of the finger pulp, there's decrease in the blood supply, and the blood supply decreases. Okay, this is regarding to the compression. This is the capillary riffle. When I took off my finger, the blood supply returned again within 2 seconds. This is the capillary refill and also the skin turgor. This is regarding to the examination in the abdomen. Is that for the poor skin turgor? This is the signs of dehydration. So this is regarding to the face in the general examination. The general looking, the higher distribution and looking, dysmorphic features, signs of pallor, cyanosis, and jaundice, any signs of dehydration. Then in the neck, what will you have in the neck? In the neck, the most important part, also in adults, the lymph node examination. How to examine? Firstly, the lymph nodes, the submandibular and the submental. Okay, the submandibular and the submental, the preauricular and the postauricular. And here there is the suboccipital lymph nodes, anterior and the posterior cervical lymph nodes, and what this is the supraclavicular. How will you examine the lymph nodes? You will sit behind the patient. You will sit behind the patient and examine the submandibular lymph nodes, submental lymph nodes, anterior and the posterior cervical lymph nodes. And this in the hole above the clavicle, this is the supraclavicular lymph nodes. Okay, the preauricular and the postauricular lymph nodes. Then sit forward to the patient, sit forward to the patient and examine the what? The suboccipital lymph nodes. Examination of the suboccipital lymph nodes. If there is no any lymph node enlargement, you say there is no any lymph node enlargement in the neck. But if there is enlargement, you should determine the site in which group, the size of the enlargement above or less than 1 centimeter. And number 3, the consistency. Is the lesion, is the enlargement movable or not? If there is tenderness or not. This is regarding to the neck. In the heart, the most important examination in the heart, the most important sign in examination, look for the fingers of the baby. Is there digital clubbing? What do I mean clubbing? This is the clubbing. Clubbing increase in the curvature of the nail, and there is enlargement, bullous enlargement of the distal finger. Enlargement, bullous enlargement in the distal finger. This is the signs of, this is the digital clubbing. This is the infant, toddler, newborn, infant, and toddler cannot do the Shamroth sign. But for example, preschool age or school age patients, ask the patient for what? For doing the Shamroth test. This is the Shamroth test. This is the Shamroth test. If there is window between the fingers, if there is window, you can look through it between the fingers. That means there is no any digital clubbing. Patient with digital clubbing will have the fingers like this. Cannot compress them. This is regarding to the digital clubbing. If there is no any digital clubbing, you say there is no any negative sign, you should mention it. There is no any finger clubbing. This is the finger clubbing. Increase in the curvature of the nail, and there is bullous enlargement. Okay. And also looking for any abnormalities in the nail. For example, splinter hemorrhage or nail pitting, koilonychia, leukonychia. If there is no any abnormality in the nail, you say there is no any negative finding regarding to the nail. Then, what will you examine in the hand? Examination of the palm of the hand, very important. Previously, we say looking for pallor. And then firstly, looking for pallor in the palm of the hand. This is number 1. Number 2, also for looking for what? Looking for erythema in the hand. Erythema. Erythema, where will you find it? Erythema in the thinner on the palms of the finger. In the eminences in the eminences, in the eminences on the palms of the finger. This is the erythema. Erythema means redness. Redness in the palm of the finger on the eminences. This is regarding to the erythema. Also, jaundice could be in the hand. Jaundice in the hand. Or maybe cyanosis. If the palm of the hand normal, you not say normal palm. You say there is no pallor, there is no cyanosis, there is no jaundice, there is no erythema. Why I will say all these findings? Because when you say these findings, the doctor know that your examination is good. And the doctor know that the examination for the pallor and for the cyanosis and for the jaundice. But if you say normal palm, the doctor asks himself, this student looks for what? So when you will say to the doctor, there is negative, no enlargement in the lymph node, there is no finger clubbing, there is no pallor, there is no cyanosis, there is no jaundice, the doctor will know that your examination is good, and the doctor know that you examined the pallor and the cyanosis and the jaundice. Finally, in the leg, what will you have in the leg? Any abnormality in the leg, discoloration, injury, scar, you mentioned it. Okay, this is routinely. But the most important exam is the edema. If there is edema. Edema, it could be generalized. Edema, it could, there is rule by 1. If you find in the leg 1 inch above the medial malleoli and compression for 1 minute. Rule 1, 1 inch and for 1 minute. 1 inch above the medial malleoli and compression by the thumb for 1 minute. To know if it is pitting or non-pitting edema. The edema, it could be generalized and it could be localized. For example, this patient has edema in the right lower extremity, but it could be generalized in the upper extremities and the lower extremities and the abdomen. This is called anosarca. The causes of anosarca, hypoproteinemia. This baby has congenital nephrotic syndrome or erythroblastosis fetalis. It could be Hurler syndrome. Okay. This is regarding to the generalized edema. Or it could be localized edema, malformation of the lymphatic system. This is regarding to the general physical examination. Any question, just in the comments, and thank you.